So that to me is a healing
That's right.
situation.
Right.
And I came from a background where my family didn't have insurance, so we would go to the kitchen to mix up little things, herbs and spices and stuff
Right.
to help you,
Right.
get over whatever you were having.
That's
But
right.
there wasn't a doctor involved in
That's
that.
right. That's
and,
right.
And so, if you think about the kitchen relating to medication,
That's right.
the science, it's all in there.
No, you're absolutely right. Yeah, you're right. You're right. And a lot of they might would not be able to tell you exactly why.
Right.
But when you would go back and do your own research, you're
Exactly.
like, oh yeah, this is
Right.
this is legit. This is what
Yes.
we should be doing. Like I said, that family member, she was doing things with juicing
Right.
back in the day that when we would have a family gathering, we were like, well, I guess she's gonna drink that by herself.
right.
Right? But then I was like, okay, tell me, what did you do? Carrot, apple, ginger, what is this? You know, because it was life or death for me. Like,
Yes.
okay, what do I do? Because the goal was, okay, God, I'm praying to you.
Yes.
I'm hearing you now. How do I show you that I'm going to take better care of this?
Right.
And so, it became that thing where I would pray, I would read the scripture, then I would see how does that, because you're right, science in the kitchen.
Yes.
And in fact, food to me is medicine.
Yeah, it is.
It's either medicine or poison.
That's right.
Right?
Yeah, right.
There's no in between, right? And so thinking about food in that way helped me again think about, especially at that point, that I wanted to live.
Right.
Right. So when you said that, I was like, okay, I've got to do better. And it was easier. The incentives were stronger. Like, I tell friends and family, my incentives were much stronger because of where I was, right?
Right.
And so making that change was easier because, again, I was thinking about life or death and family and being there for my kids and so forth. But I think for all of us, my hope was by sharing my story that they wouldn't have to get to a life or death situation.
Right.
That they could make some small steps in the changes. Like you said, praying, being intentional about how you pray, right? And thinking about, really, is this something that is a healing?
Yes.
Or am I poisoning my body? Now, that's when you start thinking about that way, it makes you easier to push some stuff aside, right? And just to know that, like sugar, for instance, sugar is addictive. It is. It's like a drug.
It really is.
And so that was probably my most difficult one. And still to this day, I have to be very thoughtful. I treat it like a drug. Like I know if I take one, that's going to end up to 10, 11, 12.
Right.
So just thinking about that for me, but I think for all of us, it is one, just finding how to be, do things in moderation. Right.
I was thinking about the fact that the cancer journey put me on a different path of what I do in life moving forward.
Right.
It helped me to create a congregational care model.
Wow.
Of how to pray, when to pray.
Wow.
That it's a way of life.
Yes.
And then you have to have a toolkit to go with that.
Right.
To make sure that you understand exactly why you're doing what you're doing. Even if you have a prayer life, it is important that you execute it in the right way.
Yeah.
And often. It's not something that you do because the crisis is over.
Right.
You have to continue that.
That's right. That's right.
Because there's going to be other challenges that you face.
That's right.
On a regular basis.
No, you're absolutely right. And it's like a muscle, right?
Yes.
It is. Just like if you don't use it, right?
You lose it.
You lose it, right? And you're so right about this prayer thing. Oftentimes we think about prayer in a way that it is so formal, right? It's just conversations.
That's right.
And for me, it's so important at the beginning of the day because it helps you think about, prepare for what's to come. I know when I'm having a bad day. I say, dang it, I didn't pray, I didn't meditate this morning, I didn't, because my whole way of responding, again, think about health.
Yes.
It minimizes your stress when you're thinking about, I've already got my mind set in a certain way that I know with God. I can handle this. I've got, scriptures I've meditated on. I know that when I don't have that, that is bringing about added stress because I'm thinking about it in my flesh.
Right.
And when I say my flesh, thinking about it, doing it my way, and getting, somebody just said something that wouldn't have bothered me if I had gone through spending intentional time. And it's a muscle. Once you start not doing it,
yes,
you kind of get a little lazy with it.
Right.
But then you're adding stress. So you're so right. Prayer is so critical, and it helps direct you in keeping your eyes open and as to the what in situations, right? Because I could now, when I prayed up and somebody says something crazy to me, instead of getting into self, I say, they must be having a bad day, right? Giving them some grace, right? So, and it helps you process not taking on that burden of, why did they say that to me? Who they talking to, right?
Yeah,
so I think you're right. Prayer is so critical.
Yeah, it's one of those things that you establish a relationship with God and the Holy Spirit,
right?
And that relationship strengthens you.
That's right. No, it does.
It makes you wiser.
Right.
You can discern more
than
you would normally have.
Right.
If you're in constant relationship. With him.
Right. So to myself, if I were to speak to my 35-year-old self, I would say, first, stop sweating the small stuff. Secondly, it's okay to ask for help. Third, there are no badges in sacrificing your body.
Right.
And fourth, remember what success looked like for you when you were younger. I think oftentimes when we get older, success changes based upon the people who are around you. And as a result, you start chasing things that were never something that you were purposed for, but you took it on because people, well-intended folks, told you were good at. And as a result, that's how your plate got so full. But going back to what tickles you, that really gives you passion, is something that will sustain you through difficult times. And for me, as a believer, that purpose is often, and I just believe, is bigger than you. So when you don't take it personally and realize it's bigger than you, it helps you onto a healing journey. Because when you start thinking about yourself, you start looking backwards versus forward when you know it's bigger than you. Also, for those who are believers, I would say it rains on believers and unbelievers. So just because you have faith, you're in the church, you're active, does not prevent trouble and challenges from coming. It is how you, just like I say, it is not that it will not come. It is how you deal with it that will show others about the faith that you profess. To the believers, to the unbelievers, I would say. To those who don't have a relationship, I would say to 35-year-olds. Again, having a community. Again, knowing not to do it alone. Starting to think about what's deeper than what you see is going to be critical in your healing process. I find it really hard to go through something without having a spiritual perspective. Because if it's all based upon how well I do or how well I get it right, that's when it becomes hopeless. It is when you feel anchored in community, anchored in knowing this bigger than you, even if you don't see it the way I see it, but seeing that it's a bigger picture here, and that if I can do something that leaves impact on others through this journey,
Yes.
that it was not worthless or hopeless, will help you get through it as well. So, as we were talking about this campaign itself, it reminded me of it is important that we meet people where they are.
Yes.
The church it's not made of perfect folks.
No.
It's a hospital, and oftentimes we don't think this journey. Because we take it and do it solely on our own, we think we're the only ones going through it.
Right.
You could not even imagine how bad this is. And so I don't even try to even start this healing journey because why? It's not for me. I feel like just like in the church, we say there's not anything you could have done wrong that is beneath healing and grace spiritually.
Yes.
I would say that for your own health journey. I don't care how broken you are. I don't care how much you have not taken care of yourself. This journey, in fact, I know for a fact in the church, it's those who have been the most spiritually broken that have had the greatest testimonies and the biggest outreach and impact, because others can connect with them because they have some wounds. And in fact, my Pastor Troy, says this very eloquently. He says, I don't follow anyone that doesn't have a limp, because that means if you have a limp, you've gone through something.
Yes, yes.
And I can now trust you because you've gone through it and you've seen the other side. So in this journey, this health journey, I would say to anyone who is saying, no, this is not for me, it's hopeless. I'm at a point where I'm at past recovery. This is exactly for you.
Right.
Because you taking a step, especially when you think it's bigger than you, you're helping not only yourself take a step, but hundreds and thousands of others, because they will see you take that step and then find hope that there are possibilities for them as well. So to me, this healing journey is for all.
Yes.
Yes.
I agree. Very well stated.
And so I would add, it is expensive. This is why you need community.
Yes.
Right? This is why you can't do it alone.
Right.
Or you will feel hopeless, right? Because you can't, when you start thinking about a community, that's why, whether it's church or some organization, it's important because the resources are there. That means you can't be secretive about it. You've got to be able to ask, right? Because like you said, transportation back and forth. Oftentimes those resources are sitting beside you in various organizations, but you have to share your journey, right? Also, I was sharing in a conversation yesterday, my husband, he just by chance, not by chance, because of his experiences, when he started working in the school system, at the time they had a cancer insurance.
Yes.
That was $5-10 a month. But for him, because he had experienced that would not have been something I would have even thought to check. But he did. And as a result, there were resources that were made available to us when I was diagnosed, as a result of him just, taking on that additional insurance, right? For those who don't have that, again, it is critical that you don't go it alone. You find community.
Right.
Fortunately, we have the internet. That's a blessing, and sometimes it's a curse. but that's where you look to identify, are there resources in the local area
Right.
that can help support you in this? Because for every dollar that's spent, there's probably some kind of program that could help actually minimize those costs. But at the end of the day, the cost of not being treated
Yes.
is ways far beyond what we're talking about. Cost for your family of losing you because you chose to not make the time, invest in yourself
Right.
in a way that, you think about as much as I wish I could have said I was all there when I first, and had the right mindset when I first was diagnosed. That's not the case. What got me thinking that way was I wanted to be there for my children.
Right.
And for me, everything kind of, you said, I want to be there beyond this. And so what do I need to do to make sure that my kids were going to be good, right? And that's kind of led me to all the other revelations. But I think as much as we say we can't, we don't have time, you don't understand, I would suggest that you rethink this and reimagine this in the way of what would happen if I don't?
Right.
For the very reasons that you said you can't. I've got to do this because of this and that. What happens if you don't? And just decide to get out of your comfort zone and seek the support that's out there.
Right.
Yes.
And for all cancer patients, there's a patient navigator. There's a caseworker that's assigned to you. And a lot of times they're not telling you that. And you need to ask, who is my social worker? Who is my patient navigator? Who is my caseworker? Because they have resources that they can share with you that will help you pay for some of those expenses. There are organizations locally and nationally that will help cancer patients pay for some of those expenses we talked about.
Yes, yes.